Good morning. This is Nurse Eunice with Florida Training Academy. And in today's CNA and PCT exam review video, we're going to cover how to care for a patient in respiratory distress. So we'll give you about 10 seconds to get your notifications, and we'll get started shortly. And good morning, everybody. So let us begin. Mr. Williams, a 68-year-old man with a history of COPD, which is chronic obstructive pulmonary disease. He's admitted to the hospital with symptoms of severe shortness of breath, confusion, and cyanosis, or his lips have turned blue. His condition quickly deteriorates, leading to respiratory failure. The healthcare team must stabilize Mr. Williams and provide ongoing care, focusing on respiratory support and monitoring. And you are the patient care tech or the CNA who will be taking care of Mr. Williams. Let us begin. All right, so Mr. Williams is brought to the emergency department by ambulance. He is struggling to breathe and appears very anxious. The paramedics have administered oxygen en route to the hospital. Question 1. What is the first priority for the CNA/patient care tech when Mr. Williams arrives at the hospital? A, ensure Mr. Williams is placed in a high Fowler's position. B, take the vital signs. C, ask Mr. Williams about his medical history. Or D, provide Mr. Williams with a hospital gown. We're focusing on his respiratory system, and he's in one of your assigned ER rooms. What is your priority? And good morning, Natasha, Fatima, and Ebony. We'll reveal the answer in 3, 2, and I do see correct answers coming through. Your priority would not be vital signs. We got to sit him up first. So the answer is A, ensuring Mr. Williams is placed in a high Fowler's position because it helps to maximize lung expansion, ease his breathing, and improve his oxygenation. If you take his vital signs, such as his oxygen saturation while he's laying down, well, the oxygen level is going to be low because you're not allowing full lung expansion. So sit him up, and that should help with his breathing. Great job, team. Question 2, how should the CNA or PCT address Mr. Williams' anxiety upon arrival? He's having a hard time breathing, so yes, he's going to be anxious. Is it A, tell him to calm down? B, acknowledge his feelings and offer reassurance? C, distract him with casual conversation? Or D, ignore his anxiety and focus on the medical procedures? No, this is an easy one for you. So this one should be easy. Communication. So it looks like Ebony and the Miller family, you have it correct. You never want to tell a patient to calm down, especially when they are having a true medical concern. You can tell them to take deep breaths, or slow their breathing, but you initially want to acknowledge his feelings. Mr. Williams, I understand, and I see that you're struggling to breathe. Offer reassurance. Let me sit you up and let's take some deep breaths. This can help reduce his anxiety and make him feel supported. Question 3, what is an appropriate way for the CNA or PCT to assist Mr. Williams with his oxygen therapy? A, turn up the flow of oxygen if his breathing remains labored. B, ensure the oxygen mask is properly fitted. C, allow multiple visitors to come in at once. Or D, leave him alone to adjust the oxygen mask himself. And great job, team. Yes, yes, yes. It is B. We got to make sure the mask is on properly because it helps to maximize the effectiveness of the therapy. You know, those patients are going to have the nasal cannula in their mouth and the oxygen mask covering their eyes. It's just never where it's supposed to be. I put a comment here beneath this photo because this is important. We do not normally use non-rebreather masks for patients with COPD. And I know that may be above your knowledge level as a CNA or a patient care tech. But usually those patients who have COPD, they wouldn't have on mask, they would have nasal cannulas on. But I just want to make sure that I gave you that additional information. And so here's our umbrella that talks about COPD. So COPD is a term that can be used to describe a range of pulmonary conditions, including chronic bronchitis, emphysema, and irreversible asthma. So high flow oxygen devices such as the non-rebreather mask that we had on the other screen can be dangerous for patients with COPD because it can suppress their breathing and increase the risk of death, which is why it's usually better managed. COPD patients are better managed with simple mask and nasal cannula. So that was some additional information. So you'll know why your nurse isn't rushing to put a mask on a patient who has COPD. Right, so let us get him stabilized. Mr. Williams is settled into a private room. The healthcare team begins to stabilize his condition with continuous monitoring and respiratory support. Mr. Williams is still experiencing shortness of breath, and you are still on your assignment. You are his caregiver. Question 4, what should the CNA or PCT do to help monitor Mr. Williams' respiratory status? Is it A, let his family explain procedures, B, check his blood pressure every 4 hours, C, tell him it won't hurt at all, or D, check his oxygen saturation levels regularly? And if you chose D as in dog, you're correct. So what we're going to check his oxygen saturations with is usually they're going to have an adhesive device that is on his finger, and that is called a pulse oximeter. So it helps to monitor the respiratory saturations, and normally we're okay for an adult if their saturations are between 94 up to 100% with oxygen. So if they're getting lower than 94%, that is when your nurses will usually start applying supplemental oxygen. Question number 5, Mr. William develops a fever during his hospitalization and requires a COVID test. How is COVID most commonly diagnosed? Is it A, through blood test, B, through a chest x-ray, C, through a PCR test, or D, through physical examination? Think about the type of test you had to do when the pandemic was rearing its ugly head. What type of test did you have to have performed? Yes, yes, yes. Chrissy, great job, you all. It is a PCR test. So you as the CNA would be responsible for doing the nasal swab in most of your facilities. Yes, they will teach you how to do it. But COVID-19 is most commonly diagnosed through a PCR test, which detects the presence of the virus's genetic material. So you have to swab deep and swab those nostrils and then submit that sample, send it off to the lab. Question number 6, why might a patient be hesitant to receive a COVID-19 vaccine? A, belief in natural immunity, B, fear of needles, C, misinformation about side effects, or D, all of the above? And Panda C, I think you got the answer correct. So great job, everybody. I see you, Claudia. If you chose D, you are absolutely correct. It is all of the above. So patients may be hesitant to receive not just the COVID-19 vaccine or COVID-20, whatever we are in right now, 2024 vaccine. They would be hesitant to receive the flu vaccine, the pneumonia vaccines. There are vaccine hesitancies, and it is regarding their beliefs in natural immunity, fear of needles, and misinformation. As a CNA, you just listen and you support them by listening, as the nurse and the doctor would have to go in and provide more information and hopefully convince this patient through research to actually go ahead and get the vaccinations. But a patient has a right to refuse, and we also respect that right. All right, so this is the doctor. Mr. Williams' condition is stabilized thanks to your great care, but he remains at further risk for respiratory complications. The CNA/PCT needs to continue to provide support while closely monitoring his respiratory status. And here is our next question, question number 7. What is a common sign of pneumonia that CNAs and PCTs should monitor for? Is it A, cough with clear sputum, B, cough with green sputum, C, increased appetite, or D, improved breathing? So we went from a patient who had COPD, who's now being tested for COVID, and now they've developed a fever. So we're suspecting pneumonia. Yes, it happens just like that. They come in with one thing and they develop something else when they're in the hospital because hospital acquired infections. We are transferring these germs around. So, what would be a sign of pneumonia besides an elevated temperature? And yes, if you said B, cough with green sputum, you are right. If it's a cough with clear sputum, we don't care as much. But a cough with green sputum is a common sign of pneumonia indicating possible infection in the lungs. And so we call it phlegm, all right, spelled Phlegm. That's another way of saying sputum. So if it's clear, that could be allergies. If it's white or clear, if it's green, that's infection. Red, there must be some type of injury. They're coughing up blood. And brown or dark, they probably have a malignancy such as cancer. So those would help you determine. You never want to freak your patient out. You just want to make sure that you're aware of the color of the sputum. You can save a specimen and then make your nurse aware. Question number 8, how should the CNA or PCT respond if Mr. Williams starts experiencing increased shortness of breath? Is it A, ignore him and let him manage it? B, tell him to stop panicking? C, leave the room immediately to get the nurse? Or D, notify the nurse immediately and provide comfort measures? Yes, I made those last two options tricky on purpose. So let's see, which one are you going to select? I am so proud of you. You know to never leave your patient alone. The correct response is going to be D. So you can't leave and notify the nurse. It's going to be D. You stay with the resident, call for the nurse, and then you provide those comfort measures such as sitting him up. Once he's set up right, you tell him to actually get him to control his breathing, take some deep breaths in and out. That's when you can start doing the vital signs. So all of that will be done before your nurse even arrives to the room. Question number 9, what is one action CNAs and PCTs can take to prevent the spread of COVID and pneumonia in a healthcare setting? Remember, we, the caregivers, spread these germs around. So is it A, encourage patients to share personal items? B, wear an isolation gown when providing care? C, practice frequent hand hygiene? Or D, ignore infection control protocols? And we'll reveal the answer in 3, 2, and I see a C, I see a B. Any more guessers? I see another C, and you are correct. It's C. So if all we do is put on a gown and we never wash our hands, we're still going to be spreading the germs. So practicing frequent hand hygiene is a key action CNAs and PCTs can take to prevent the spread of COVID and pneumonia in healthcare settings. And a gown wouldn't be as appropriate as a mask if someone has a respiratory condition. So it just depends on the condition they have. And for those of you all who are going to be taking your clinical test as CNAs or patient care tests, don't forget to wash your hands. That is one of the main reasons that you fail your clinical test. Don't forget that hand hygiene should be performed before and after every skill that you perform. All right, so the CNA ensures that Mr. Williams's care plan is followed and communicated effectively with the healthcare team. Question number 10, how can you ensure effective communication? Is it A, document all observations and share during shift changes? B, only report major changes? C, keep communication verbal and informal. In other words, never write anything down. D, handle issues independently without involving the team. And I don't expect for any of you to get this wrong. That is right, team. We document And first we report, because when you document, you need to document who you reported the change to. So it's going to be vital signs, blah, 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 whatever the numbers are. Patient resting well. However, respiratory rate is now, I'll say 30, something abnormal. You would then report that abnormalcy to the nurse. And when you document in your chart, you would make sure that you put down the nurse's name that you told that information to. So documenting all observations and sharing during shift change is important, but sharing in real time when your patient is in a more acute state is vital in order to make sure they get appropriate and timely care. Question 11, what is the role of the CNA/PCT in Mr. Williams' care plan? And if you've never seen a care plan before, I have one for you on a subsequent slide. So is it A, to create and implement the care plan? B, follow the care plan and report any concerns? C, make decisions independently? D, focus solely on emotional support? What do you think a care plan is? And how does it benefit the patient, the nurse, the CNA, the doctors? So, as a CNA, when a patient has a care plan, it is created by the nurse. And you do B, you follow the care plan and report any concerns. This ensures that the patients receive consistent and comprehensive care. And this may be hard to see, but you can always go back to it later. This is a sample care plan for a patient who has COPD with PNA, which is an abbreviation for pneumonia. And so one of the nursing diagnoses or assessments is going to be ineffective airway clearance related to increased production of secretions, cough with sputum production. And the goal would be to prevent and to control the exacerbation. But let's go all the way down to the, now we're in the center where it says the nursing intervention. This is where you're going to help. It says provide an spirometer for the measurement of airflow obstruction. And then at the very end where it says evaluation, this says goal not met because patient refused to participate in the teaching of spirometry and stated that they were tired. So this is ongoing. Just because the goal wasn't met today doesn't mean that tomorrow will not be different. So we always provide education and reassurance. And this is an image of an spirometer. So it has a piston. You're going to tell the patient to let out air. They're going to blow out, and then they're going to put the mouthpiece in their mouth, and they're going to breathe in. Incentive. They have to breathe in. When they breathe in, tell them they're trying to suck a milkshake through a straw. And that's going to get them to exercise their lungs. And that piston that's on the right-hand side is going to go up. And the goal is for them to keep using this to exercise their lungs and to get that mucus to start coming up. Question 12, how often should a patient typically use an spirometer? Is it A, twice per shift, B, every hour while awake, C, only when experiencing shortness of breath, or D, twice a week? I'll be revealing the answer in 3, 2, and I see B's, I see C's. It is a mix, but the correct response is B, every hour while awake. And if you are annoying like me, pretty much every commercial break. All right, Miss Eunice, let's get you to use that spirometer. Every time there's a commercial break, let's get you to do some of your breathing exercises. So patients are usually instructed to use their spirometer every hour while awake to promote regular deep breathing and lung expansion. So we have to do this more than just twice per shift. All right, so this is you. We're ready for discharge planning. As Mr. Williams' hospital stay comes to an end, the focus shifts to discharge planning and ensuring that he has appropriate follow-up care. Question 13, what role does staying hydrated play in preventing respiratory fatigue in patients with COPD? Is it A, it reduces the need for medication, B, it improves circulation, C, it decreases appetite, or D, it thins mucus, making it easier for it to clear from the lungs? Why are we encouraging hydration for patients with COPD? And I'm doing my happy dance, Panda, Marsha, Chrissy. You're absolutely correct, Queen. Yes, great job, everybody. So I do want to state that yes, fluids improve circulation, but this patient specifically has COPD. So for a COPD patient who has mucus trapped in their lungs, it is D because the fluids thin mucus, making it easier to clear. So staying hydrated helps thin mucus, makes it easier for it to clear the lungs, and this can reduce the effort needed to breathe and prevent respiratory fatigue. So since this was specifically about a person with a respiratory issue, this one, the best answer would not be circulation. It's to clear, excuse me, it's to thin the mucus. Question 14, why is it important for patients with COPD to avoid environmental pollutants at home? Is it A, because they gain weight? B, they can exacerbate respiratory symptoms and increase fatigue? C, they reduce appetite? Or D, they improve lung function? Which is true about environmental pollutants at the home? And I am so proud of you. Great job, Tamara, Marsha, Fatima. I don't want to pronounce your first name, it's pronounced so Miriam, Chrissy. I see you all. Yes, team. Environmental pollutants such as smoke and strong odors can exacerbate respiratory symptoms and increase the risk of respiratory fatigue, which is why, as a healthcare provider, believe it or not, we're not supposed to have on perfumes. We're not supposed to have on strong fragrances because it can irritate your patient's lungs. So try to follow those policies, especially if you have a patient with allergies or respiratory disease. Question 15, which diagnostic test is commonly performed before a patient with COPD is discharged from the hospital to assess their lung function? Is it A, an electrocardiogram or ECG, B, a chest x-ray, C, complete blood count, or D, pulmonary function test? And this one's tricky, everybody. So a chest x-ray would tell us if the person still had fluid in their lungs, but it doesn't assess their lung function. It is going to be D. I'm so happy I taught you something new. It is a pulmonary function test. So we have the little mini devices at the bedside, the spirometer, but no, they're going to have to go down to a lab and they're going to be in a booth with a nose clip on and they're going to be using an industrial size spirometer. So a pulmonary function test, or PFT, is commonly performed to assess lung function in patients with COPD before discharge. This test measures how well the lungs are working and helps to determine if the patient's respiratory status is stable enough for discharge. So yes, we're going to have that chest x-ray, which looks at organs, but that doesn't tell us how well this person is going to be saturating or if they're going to get fatigued. The PFT does that. Question 16, what follow-up support might Mr. Williams need after discharge? Will he need respiratory therapy, medication administration, cardiac rehab, or Meals on Wheels? I'm so proud of you. I'll be revealing the answer in 5, 4, 3, 2, and let's focus on the system he came in the hospital for. He came in the hospital for respiratory distress. So he's going to need a respiratory therapist. Yes. So they can provide the ongoing support and help manage his respiratory condition. And of course, the nurse kind of facilitates all the other disciplines in home care, but the respiratory therapist is going to be the one who's calling a pulmonologist, which is a term for a doctor who focuses on the lungs, and he or she would be communicating directly and getting orders related to the respiratory system, and the nurse would manage everything else. Question 17, which of the following actions should be avoided to ensure oxygen safety at home? Remember, COPD patients are sometimes they can become oxygen dependent, and so they're going to need low flow oxygen via a nasal cannula. So would it be A, use a humidifier with the oxygen concentrator, B, clean the oxygen mask regularly, C, and we're talking about what should be avoided, C, smoking or allowing open flames near oxygen equipment, or D, using a grounded electrical outlet for the concentrator. Mr. Williams' life is about to be changed, but he's going to have support from a wonderful medical team and providers like you. So if you know that when someone has oxygen at home, that C would be contraindicated, you're absolutely correct. They should not smoke. There should be no open flames because oxygen is a gas and it can ignite. We don't need any fires. We don't need any explosions. So oxygen safety is going to be important, and you will learn how to maneuver oxygen tanks and more about oxygen therapy when you get into your facilities. Question 18, what is the safest way to store oxygen tanks at home? Is it A, in a locked closet, B, near a heat source, C, in an upright position secure to prevent tipping, or D, lying flat on the floor? So Mrs. Williams is concerned. She's like, oh my God, my friend's family member has oxygen, and I just heard so many bad things. What do I do with the oxygen tank? And if you chose C, you are right. You're going to keep it in an upright position, secure to prevent tipping. But you have a whole team. So the DME, which is called durable medical equipment, they're going to be providing equipment. They're going to provide the stable stands for the oxygen tanks to go on. So for you, this is just additional information, but you have a whole team that's going to be helping this patient at home. So oxygen tanks should be stored in an upright position and secure to prevent tipping. This reduces the risk of the tank falling and potentially causing damage, injury, or explosion. Don't forget about that. Great job, team. I am so proud of you. You have taken very good care of Mr. Williams, and him and his family, they say thank you for the care that you provided during this hospitalization. I want to thank you also for being on here with me, for learning a little bit more about taking care of a patient who has a respiratory condition and helping to prevent that condition from worsening. So again, this is Nurse Eunice with Florida Training Academy. I appreciate you so much. For my babies who've taken their test this week, I wish you much success. And for those who took their test last week and passed, congratulations. If you haven't passed your exam, don't give up. You can always send your test scores to me at admin@fltraining.com, and I'll review them whenever I have opportunity and help you strategize a plan for you to be successful and pass your exam in the future. So everybody, have a wonderful day, and I'll be back on here on Friday.